Thank you, Mr. Chairman. Dr. Fauci, when is the time? When is the time? Well, in your written statement, you say, now is not the time to pull back on masking, physical distancing, and avoiding congregate settings. When is the time? When do Americans get their freedom back? Can you put your microphone on, please?
Sorry. When we get the level of infection in this country low enough that it is not a really high threat.
What is low enough? Give me a number. What, I mean, we had 15 days to slow the spread, turned into 1 year of lost liberty. What metrics, what measures, what has to happen before Americans get their freedoms back?
My message, Congressman Jordan, is to get as many people vaccinated as quickly as we possibly can to get the level of infection in this country low that it is no longer a threat. That is when. And I believe when that happens, you will see.
What determines when?
I'm sorry.
What measure? I mean, are we just going to continue this forever, or when do we get to the point? What measure? What standard? What objective outcome do we have to reach before Americans get their liberty and freedoms back?
You know, you're indicating liberty and freedom. I look at it as a public health measure to prevent people from dying and going to the hospital.
You don't think Americans' liberties have been threatened the last year, Dr. Fauci? They've been assaulted. Their liberties have.
I don't look at this as a liberty thing, Congressman Jordan.
Well, that's
I look
obvious.
At this as a public health thing.
But
I disagree with you on that.
You think the Constitution is suspended during a virus, during a pandemic? It's certainly not.
This will end for sure when we get the level of infection very low. It is now at such a high level, there's a threat again of major surges.
Dr. Fauci, over the last year, Americans' First Amendment rights have been completely attacked. Your right to go to church, your right to assemble, your right to petition your government, freedom of the press, freedom of speech have all been assaulted. I mean, for a year now. So I just want to know, when do Americans get their First Amendment liberties back?
You're making this a personal thing, and it isn't.
It's not a personal thing.
No, you are. That is exactly what you're doing.
No, your recommendations carry a lot of weight, Dr. Fauci.
My recommendations are not a personal recommendation. It's based on the CDC guidance, which is
And I'm asking the question,
underscored.
what measures have to be attained before Americans get their First Amendment liberties back?
I just told you that.
No, you haven't given anything specific. Businesses have been shut down. People can't go to church. People can't assemble in their own homes with their friends, with their families. People can't go to a loved one's funeral. People can't get to their government, petition their representative to redress their grievances. Right. I also understand the First Amendment's pretty darn important, and it's been a year, and I want to know when Americans will get those First Amendment liberties back.
The gentleman's time has expired. I'll give you one instance of when we can get our liberties back. It's when 90% of the members of the United States Congress get vaccinated.
Well, I want to know if that's what Dr. Fauci, is it 90%,
That's what
Dr. Fauci? Is it 90%? That's what I'd like to know. Give us some objective standards versus when certain things get reached, we might be able to get back to having our liberty. When? What are the numbers?
Well,
You're going to see a gradual, right now we're at an unacceptably high level. On a daily basis, it's unacceptably high, regardless of who you are. What you're going to see as more and more people get vaccinated, and we get over 3 million people a day, you're going to see the level of infection come down, and gradually there will be more flexibility for doing the things that you're talking about.
Where does it get to? When it comes down, what number do we get our liberties back? Tell me the number. Tell me the number.
When 90% of the members of Congress get vaccinated.
But you're not a doctor, Mr. Clyburn. He is. What is the number?
I can't
Thank you for recognizing me, Mr. Clyburn. Thank you.
Chair now
for giving me the
recognizes
time.
for 5
I'd
minutes.
like my question
Ms.
answered.
Maloney.
I don't want.
Reclaiming my
I
time.
want a
Reclaiming my time.
Regular order.
No,
Just a moment.
Mr. Chairman, I don't want you to answer my question. The American people want Dr. Fauci to answer the question.
But
What
you
does it
can't
have to be?
expire, sir. You need to respect the chair and shut your mouth.
Fairly straightforward question, which one we've been asking since last April. Give us the objective metrics. When can kids go back to school? We know that's not dangerous. When can we get our freedom back? And always moving the goalposts. But his guardians rushed in to defend him, didn't they?
Yeah, but I mean, in what world does an unelected bureaucrat get to tell American citizens when we can exercise our God-given liberties?
He was asked a scientific question, and the scientist sounded like a politician. He dodged. He wouldn't answer the question. All he said was, when, as a scientist, can we go back to normal?
What Jim Jordan was getting at was the devastation that's happened to this country. I think there's still so much shock. I don't think people even realize how extensive the damage to the country is by some of these decisions that were made in terms of the lockdowns and the response to COVID. Well, I don't understand why all of these people can't see the larger picture of what's happened in this country. The impact on people's lives outside of COVID is so devastating, and I think it's going to take us years to recover from.
Here's the bottom line. The states that were shut down the most have the highest COVID rates, like New York, New Jersey, California.
Florida is relatively open. California's locked down, and the age-adjusted death rate is actually worse in California. We paid this enormous cost in terms of these lockdowns in so many ways, and yet we've gotten very little for it.